one of the deepest, I think, flaws in the 12-step and the whole codependency and self-help movement that emerged is that it ends up blaming the individual, and it blames the individual in very unequal ways. So if you think about how the 12-step program was actually set up for male, and rehab was set up for professional men and priests and doctors. That's who Hazelden was created for. And when you put that on women and you know, BIPOC community members, and it might not necessarily work because of trauma, because of an unequal entry into that whole world of, you know, the 12-step model. All that to say that mothers get blamed for enabling, which comes out of the whole codependency, Melody Beattie stuff, get blamed for enabling their children by taking care of them. So they're in this just untenable double bind. So I was told, just kick her out. I mean, that was like turning my skin inside out when that happened. So, you know, I think, and then that's not a solution. And mothers know that's not a solution. That if we continue to help our adult children into their 30s, it becomes our problem. We must have a problem. So that kind of bind, and then the other part is about mothers and advocacy, which I also wrote about. And it was, I mean, I'm not going to slam all the white-bodied moms who went to the Capitol and got the legislators to allow naloxone, the overdose prevention drug, the overdose antidote. Their stories were so powerful. I was with them in rooms where they're just like standing there going, I don't want anybody else's kid to die. And this like law and order, you know, guy from, you know, wherever in Minnesota is like, right? Like, I'm not going to go up against her. So there's this really interesting like thing between powerless and powerful, right? That I think historically women have straddled in our, you know, and are still doing it today. I mean, it's, yeah. So we are trying to navigate like systems. I have a friend who says, I have a master's degree and I couldn't figure out how to get my son on Minnesota Care and get the care that he needed. So, and insurance and treatment. And so and I found myself in that same situation too. So I think there's a lot that could be said about how systems are set up to not really help, and then advocacy. Mm-hmm. What I think needs to happen is I think that we need to take the models that have been siloed from each other. I've only talked about one, which is, well, I've talked about two. Medication, that medical model is completely separated from the 12-step model because one sees itself as scientific and just follow the doctor's orders, and the other says just listen to your higher power and keep coming back and don't use anything ever again, or you're a failure. So we have these like two extremes, and then we have harm reduction, which comes up in the 1980s as a result of the HIV/AIDS epidemic. So we have like three models that are completely siloed from each other. And because this is the other thing too, is there's the assumption that if you're using drugs and you are physiologically addicted, you will, of course you want to stop. And it's not true. There are many, many successful injection drug users who are able to manage their life. But the only people we see are the people who can't. But I think what we need is an integrated model that addresses the harms and tries to help people reduce them so that then they can come to it as they're ready. and they feel respected, and they feel cared about, and they have a real connection to someone in a community setting. And I think this is also really speaks to people of color and immigrant communities and their relationships with police and authority. That if the thing that is illegal could get you in way more trouble than it will get the white kid, you or your family aren't going to reach out because you're terrified of what's going to happen. You're going to end up in prison, right? So you don't have the money to pay your way out. So we need an equitable system that addresses like the individual issues and the individual things. So I love the Solace apartment model, and I think housing that is not based upon drug use needs to be a priority. People have to have housing, and their family needs to know that they're safe, because the family, you can't feel okay about someone recovering if you know that they're living on the street. You just want them to not die. And then if you're really worn out and it's been 10 or 12 years, or however long it's been with your loved ones, you just kind of throw up your hands. We have to find ways to engage the broader public and policymakers in these conversations that are hard, because it's so easy to dehumanize people. It's so easy to, I think of drug court as an example. I mean, it has had really good successes and it's had really good intentions, but it's still based on that carceral model, right? That you slip up and you're in prison. My former son-in-law in a treatment facility, he was like, yeah, half the guys here don't want to be here. They're only here because they didn't want to go to jail. Now, what kind of a place is that for someone who's wanting to get better? But we need a combination of treatment centers. Someone that is in my book who has just opened a new kind of center based on individual care and mental health issues is Paula DeSantos. She's in the chapter on stigma, dissecting stigma, and imagining new treatment models. There's several people in there. Yusuf Shafi. I feel like the people who are doing some of the more grassroots, housing first, secure housing, harm reduction organizations, people who are working just kind of, Julie Hooker is another person in my book who I think is doing really interesting and important work in her clinic. People like Faria, who people who are setting up kind of these like specific places. We need to pull them together and say, what could we do? Okay, here's your ideas, and you've reached out, you've created something for people who weren't being cared for in your community. Okay, now we all have these little organizations. How can we come together? It reminds me of the women's movement, right? It reminds me of like how there's a consolidate, there are all these little interest groups, and then you kind of need to all kind of come together. So something that is like has funding, which is where I was going to get depressed about, because who controls the funding, but something where there's some kind of like a think tank that allows these different models to express themselves. I mean, the work that's happening at White Earth Nation is profound. It's so powerful. So, and same with these other people I mentioned. So it's daunting, and it's really hard to imagine, because you think about when I first logged on here, people were talking about like the not in my backyard, and people being so upset about housing, and for people with, group housing or anything like that. And the same goes for methadone clinics. Nobody wants methadone clinics around their neighborhoods. Yeah. So what can we do to change? How can we change the conversation, I guess, is going to be part of it.